How does a doctor like me figure out if you have frozen shoulder? In today's video, we're going to get into the different tests that I do in the office to determine if someone has frozen shoulder, which is also known as adhesive capsulitis. Hi, my name is Dr. Mark Gruner. I'm a board-certified sports medicine physician. I see patients with frozen shoulder in my practice all the time. Doctors diagnose frozen shoulder mainly by listening to your symptoms and examining your shoulder. It is mainly a clinical diagnosis, and imaging tests are only done if your symptoms are unusual or if your doctor wants to make sure something else isn't causing the problem. During the exam, the main finding is a clear loss of both active, meaning I'm doing it, and passive, meaning the doctor doing it, shoulder motion. This can be especially noticeable when you try to put your arm over your head. The shoulder often feels stiff and painful, and these symptoms usually get worse at night. Comparing the movements of both shoulders helps the doctor to see how limited the shoulder is and if there's a loss of motion. A loss of more than a quarter of normal rotation or difficulty lifting the arm to the side is a strong clue that someone might have frozen shoulder. When doctors diagnose frozen shoulder, it is important to rule out other causes, such as rotator cuff tears or arthritis. X-rays are often the first test that help rule out fractures or arthritis. Frozen shoulder, X-rays usually look normal. Ultrasound, which is an amazing diagnostic tool that can be done in the office in conjunction with physical therapy, can be helpful because it can show thickening of the capsule. You can evaluate the rotator cuff tendons to make sure they're not injured, and you can see if there's anything impinging on the shoulder dynamically. It's also useful for guiding injections and making sure the injections are accurate and in the right location. MRI can show more detailed changes of the joint cartilage and also the labrum and cushion that can reveal swelling and inflammation in the joint. These findings of frozen shoulder are typical of frozen shoulder, but MRI is not always required unless the diagnosis is uncertain. To sum it up, frozen shoulder is diagnosed mostly by how it feels and moves. The key signs are slow onset shoulder pain and a major loss of movement, both actively and passively. Imaging tests are used to rule out other problems to confirm the diagnosis if it is unclear. What questions do you have about frozen shoulder? Leave them in the comments below and I will do my best to answer them. Hope you found this helpful. Remember to hit like and subscribe below, and I will see you in the next video.